Children's Hospital Oakland is a pediatric hospital that takes care of children from infancy, from birth, up until their 18th birthday.
It's the level 1 trauma center for children in Northern California, but it has every specialty and subspecialty from community pediatrics up to the most sophisticated pediatric care. Because we work in the intensive care unit, sort of by definition, the children who are referred to us are critically ill. In any situation, time is of the essence.
When a patient comes from a distance that requires transport to us through helicopter or fixed wing, we call reach first.
We like to think of ourselves as a medical company that happens to use aircraft.
We'll get a call from a referring ED, and he or she will tell us the story of what's been going on with the child and their assessment of the child. We ask as many questions as we can to get as accurate a picture as we can, but a picture is worth 1,000 words, and so it's often really helpful to see what a child looks like.
In the past, we've relied on telephone and verbal communications, but descriptions sometimes get lost in translation.
With the visualization of the patient, we can have the most accurate assessment possible.
Now we can video interface with the transport team. We can communicate with them directly about some concerns they have for things we couldn't see before.
Video helps sending facility doctors to fill in the gaps in their assessment. The sending and the receiving physician can make a collaborative decision together real time during video to do what's right for the patient.
In a critically ill patient, minutes are of great value. Once the receiving hospital is able to visualize the patient, they can immediately begin treatment and giving us direction rather than waiting for the patient to arrive at the facility and realizing what the clinical condition of the patient is and starting the decision-making at that point.
I think it just makes the nurse, medic, and physician relationship much stronger when we're all on the same page treating the patient.
With the video technology that we're using, it definitely brings a higher level of care to the patient.
The visual brings everything together. It's instant. It is probably the best tool that we have to incorporate everything that is going to go into that patient care.
We've seen it used with patients that have diabetic emergencies, neurosurgical emergencies, traumatic cases, medical cases. We've seen it in a whole variety of different situations.
We look at this as such a great addition to the medicine that we already have and the knowledge and the communication.
One of the things that we also found appealing was that we didn't require a lot of extra equipment to use it. It's a web-based system, and so you can use it on your iPhone, you can use it on your whatever kind of phone you have, your laptop, your computer. It's really easy to start with. It's not cost prohibitive, and you can use it from anywhere that has wireless or cellular access.
Mobility is very important because sometimes the transport teams themselves will be picking a patient up in the field. They never know which area of the emergency department they're going to be in when they're picking the child up, or an area in the hospital.
Mobility of the video is very important. The more mobile it is, you're able to convey further important information rather than a fixed one viewpoint.
It can make a humongous difference in the outcome.
We can really improve clinical outcomes and even decrease mortality for some of these patients, whether you're an adult or a child.
I think it expands the flexibility, really, of access to care.
Now, after using it for so long, I would consider it indispensable.